After 3 years of anguish from COVID-19, the world is breathing easier again. The World Health Organization has downgraded the pandemic from a global emergency, but has warned the danger is not entirely gone.
The worst thing any country could do now is to use this news as a reason to let down its guard, to dismantle the systems it has built, or to send the message to its people that COVID-19 is nothing to worry about.
South Africa was the worst hit African country. Over 100,000 people died from the virus in 3 years. Local health authorities have cited several reasons, including global connections, a high rate of comorbidities and rigorous screening.
We have also a little bit further advancement compared to many of our neighbors in terms of diagnosis and testing, especially when the pandemic broke out. Even here in South Africa, we had some capacity to test, but not as extensive as required, but far better than many of our neighbors.
COVID-19 had a devastating impact on families and livelihoods and brought added pressure to the health system, already overburdened with diseases such as HIV and AIDS and tuberculosis.
Because we've had to divert our energy and efforts at treating COVID, those diseases obviously have been put on the back burner. And so now we are trying to accommodate and treat the TB patients who have been lost to care, HIV patients who've been lost to care, the cancer patients who've not had surgery. That's an absolute tragedy.
There were a few silver linings. South Africa championed the fight for vaccine equity. It is also home to the continent's first vaccine development hub, which brings greater health security.
We have Afrigen developing a technology, an mRNA technology, that we will use to establish and technology transfer to local manufacturers on the African continent. We will transfer know-how and expertise because we really need to develop human capital.
Although the threat of COVID still remains, the healthcare system is no longer overwhelmed by its presence. South Africa can now focus on getting its health programs back on track and double up on goals set out in the 2030 Sustainable Development Agenda. Julie Shara, CGTN, Cape Town, South Africa.